All right, so we got another one. Let's see what we got here. Let's check it out. Let's see what's going on. Man, so this patient right here, we got quite a bit of calculus going on here. A lot of crowding with this particular case too. So you can kind of look on that patient's right side. You can see how that tooth is kind of pushed back. That's what we call crowding. And it's a food trap. And if it's a food trap, it's likely that calculus or hardened plaque can live there too as well. So what is calculus? Calculus is actually that yellow, it can sometimes be brown. That's not just plaque, it's calculus. Calculus can also be called tartar, and it's hard. It's hardened plaque that has been sitting on teeth for weeks, months, or even years at a time. We are removing the calculus on this particular patient. So you can kind of see them going in with the scaler there and removing that calculus. Calculus just can't be removed with just normal brushing. It really takes a little bit of time and different instruments in order for it to be removed. So that's what you're actually seeing right now. So the facts about calculus is it's actually formed when soft plaque mixes with the minerals inside of your saliva. And it takes about 24 hours to 72 hours for it actually to harden. So that's what you're actually seeing going on right here. This is calculus. You cannot brush this off. So I've had a patient in the comments of another video that asked, why can't we brush this off? Once this plaque hardens into calculus, toothbrushing is not going to do it. Mouth rinses are not going to do it. Peroxide is not going to do it. It's adhered or stuck to your teeth, and you need this instrument here, which is called a cavitron, to actually break off those portions of calculus on the teeth. It is like fused almost to the teeth. So with the cavitron, what actually ends up happening is it vibrates as well as it shoots out water really, really fast. And then it also has a small hook there that kind of helps to break up. So you can kind of get underneath those deposits, those calculus deposits, to remove it. So that's what we're actually seeing here. So they're just kind of moving through all of the teeth and just kind of breaking it up. After it's broken up, sometimes, in most cases, we'll use perio instruments to actually remove the calculus off of the teeth even more and do what we call a fine scaling. So they're just kind of running through and just kind of removing all of the calculus in between the teeth here. We see a lot of crowding here, which is a food trap, and it's difficult. So you can actually see them kind of going in between the teeth and trying to break that off. This is why it's so important to actually come and hang out with a dentist, 6 months at a time. In some cases, you may have to come as frequently as 3 months if you have periodontal disease, you have to come and hang out with us a little bit more so that we can remove those things. So this is the before. This is actually what we have going on here, and this is what the after looks like. Thanks for watching, man. Y'all be blessed.